And let's see what we got.
Here's Kristina. Hi, Kristina.
Okay. So
The
that's
Saints,
all working.
It's the Saints come marching in one by one.
Okay. Okay, so Shelley, I think the technical side has been taken care
Great.
of, and it's yours to take away.
Great. Welcome to the April meeting of the Health and Human Services Committee. By the way, Madge, I sent you what you needed. Okay. And we're very fortunate this evening to have wonderful presenters, and which I'll introduce in a minute. But I just want them to meet the committee members who are here. So up, what depends on where you are, there's Madge Rosenberg, okay, Audrey Isaacs, Rich Robbins, okay, and Kristina Villarini, and Mark Dilla, who's an ex officio member tonight. And there'll be more coming on. My co-chair, Catherine, is I believe on her way to Holland right now, so she will not be here with us this evening. Max, can you split the screen?
I'm not sure what you're.
Can I split my screen?
Oh, that.
Yeah, that's it. Okay. So I just want to begin before I introduce our first presenter. Our district needs statement, one of the three most important, most significant issues facing us under the topic of social services was food insecurity. And I'm going to read this because it may be shocking to people who are on the Zoom. 25% of Community District 7, and that's from 59th Street to 110th, from Central Park to Riverside to the river, okay, are food insecure. Okay, the meal gap, New York City's measure of food insecurity, represents families and individuals missing meals that result from inadequate household food budgets. In Community District 7, the annual meal gap is 4 million meals, up from 3.3 million pre-pandemic. The gap directly impacts community health and healthcare costs. Every person needs stable, reliable access to food that meets their specific nutritional requirements. Many seniors rely on meals at their local senior centers, but the center's food programs are underfunded. Currently, senior center contracts cover less than half the actual cost of the meals. Children rely on free meals at public schools, but lack food on the weekends and school holidays. Hunger impacts the child's nervous system and prevents that child from learning and staying focused. Food insecurity is also a leading cause of lifelong health and mental health issues. Meal programs and food pantries face ongoing increases in the cost of meal due to labor and raw food costs, without a corresponding increase in government funds and donated food. The need for increased government support is compelling. And that's just an overall statement of what we said in our 2023 district needs statement was one of the three most serious and most important issues to us. Now, we can formulate resolutions and promote them, but we need the information. And fortunately, we have probably the best person with us to help us do that. Not only because she represents a food policy center at Teachers College, but also because they produce together with, I believe, Hunter and CCMY, Food Policy Centers, an important document of research, which is comprehensive and I think very, very valuable. And I think it's our responsibility then to promote it to the community to go to our elected officials and to get them to act on these recommendations. And you'll see how significant a lot of this information is. And so it's my distinct pleasure to introduce, Dr. Sarah Abiola, who is the Executive Director of the Tisch Center for Food Education and Policy, also Associate Research Professor, Department of Health and Behavioral Studies at Teachers College of Columbia University. I had the pleasure of spending almost an hour speaking to her, and I'm sure what she has to say and to share with us to be of great value to inform our promotion of issues on food insecurity and recommendations. Okay, Dr. Abiola.
Well, thank you, Shelley, for totally overselling my presentation this evening.
I know it's going to be everything that I expect it to be. So,
awesome. Well, thank you for that very warm introduction, and good evening to everyone. It's wonderful to be here, and I think the most exciting thing about talking with Shelley last week, and certainly about our conversation this evening, is that it represents the potential for us to actually do something together about the very important issue of food insecurity. And I think that the numbers that Shelley shared are a wonderful kind of introduction to the topic. And I'm just going to provide additional context, additional kind of understanding of how food insecurity looks in the city across the boroughs, and then talk a little bit about the policy implications for that. So I'm looking forward to the conversation. I've tried to keep this to under 20 minutes or so, understanding that we have other wonderful speakers. So I'm going to get to it right now. I'm going to try to share.
Okay, if I could just say one more thing.
Sure.
That we're helping us out, certainly, but you should know for the future that we have a relatively new district manager, but experienced one, Max Vanderveer, who is on waving, and is going to help us out tonight, as he does from early in the morning to late at night. So,
well, Max, it's wonderful to have you on. I think I can share my screen from my computer.
Thank you. You do. And actually, Mark, who's also on the call, is generously also helping, if not mostly helping tonight, as I kind of do some other work also in addition to the meeting. But it's very nice to meet you, and thank you for coming. Thank you, Shelley, for the nice introduction.
Thank you so much. So let's see if I can share screen, and let's hope that, can everyone see these PowerPoint slides now? Okay.
Clear as crystal.
Thank you so much. I see a thumbs up from Madge as well. Okay, great. So all of this is just kind of the background that Shelley just gave, so we'll just move right along. Just a brief note about the Tisch Food Center. For anyone who's unfamiliar, we do conduct research on food, nutrition, education, practice, and policy. And our goal is really just to do what we're doing right now, have the conversation we're having at this moment, where we can talk to anyone who's involved in the process of developing policy and advocating for more healthy, just, and sustainable food and food systems. So this is absolutely an important conversation for us to be a part of. So I'm happy to be here. So in kind of an effort to make sure we're all on the same page, I'm probably going to spend what seems like a lot of time trying to define food insecurity, and by extension, kind of food security. But I think that defining it is important because we can only really measure certain things at the moment. And so understanding what those measurements look like helps us to really inform policy. We're going to look specifically at what's happening in New York City, general trends since the start of the pandemic. And then we're going to talk about post-pandemic food policy and what that might look like in relation to food security and insecurity. So to start off with, food security is a concept that in its most kind of broad and comprehensive version, as articulated by the UN Committee on World Food Security, really wants to see all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their food preferences and dietary needs for an active and healthy life. A key thing that we're not going to touch on today is the latter part of that definition, an active and healthy life. Unfortunately, we haven't even gotten to the point where we can really fully embrace that definition, but the USDA, which is part of this conversation in important ways, I think is moving in that direction as they explore the concept of nutrition security and what that means. And we'll talk about that a bit more later. So the USDA has their own definition of household food security, and it exists when all members at all times have access to enough food for an active, healthy life. So it's similar, but it focuses on households. And in essence, it's a concept that exists on a sliding scale. So a household that has no reported indications of food access problems or limitations is considered to have high food security, and a household that only has 1 or 2 reported incidents might have what we call marginal food security. Both of these are still considered to be food secure. But when you get to the lower end of that spectrum, when it becomes more frequent that a household has to go without food or there's more limited access, we cross over the line into what we call food insecurity. And I think that's what we're most concerned about for today's conversation. So the hallmark of food insecurity, as Shelley alluded to, is just limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. And that component around socially acceptable ways is designed to suggest that we are thinking about people who are able to, for example, purchase their own food as a kind of an integral part of that definition. So what happens when a household has regularly reduced consumption, or they are regularly changing their dietary patterns because they don't have enough money to purchase food? We say that they are in fact food insecure. So if we look at this on a national scale, which we can do with the food security supplement, just to put what's happening in the city in context, there are a few different things that are very consistent across all households that have low food security or very low food security. They are worried that food will run out. They are worried that the food that they bought will not last, and they cannot afford balanced meals. So if you look at the yellow lines there, households that have very low food security are almost always demonstrating these particular characteristics. Conversely, households that are food secure almost never worry about running out of food. They don't change the size of their meals. They don't skip meals. They don't feel like they aren't eating enough, in essence. So what does this mean from a kind of prevalence standpoint? Overall, about 14% of households in 2020 would be characterized as having been food insecure at some point during the year. And if we look more closely in a 30-day period, we see that number falls a bit. So we're sitting around between 8 and 9%. This translates into about 14 million households. There are about 6 million children that would be included in that number. So we are dealing with a problem that affects millions. And we might wonder, well, how does this kind of relate to what we might think of as kind of hunger? There is a relationship, and I think it's important to kind of define that, because many times we can conflate the two, but they are distinct. So hunger is something that we tend to think about as happening on an individual level. It can certainly be the byproduct of food insecurity, meaning kind of sustained, ongoing, involuntary lack of access to food can result in discomfort, illness, and weakness. These are things that we don't really have the capacity with the current tools that we have to measure in a way that really does them justice. We would certainly have to have a conversation with kind of those who are in the space of collecting the data to think about how we could broaden things like the food security supplement to really measure hunger, but it certainly exists. And so I want to make it clear that that condition, which is certainly very pressing, is part of the food security conversation. And we certainly don't want to overlook that just because we don't have the capacity to measure it adequately with our current tools. So let's kind of drill down on food insecurity in New York City, kind of being mindful of the pandemic response and what that has meant for how we think about food insecurity in the city. So in April 2020, a lot happened. There were a lot of different programs that were deployed at the start of the pandemic in an effort to address the just very real problem of food insecurity. So the city spent millions in different ways. There was a $25 million investment in the food pantry system. There was a $50 million investment in an emergency food reserve. The creation of Get Food NYC included things like grab and go meals and the emergency food home delivery program. All of these things were just kind of a compilation of policies that kind of were born of the fact that we were in a pandemic. And by August 2020, there was a need to essentially extend and find additional ways to preserve these emergency response programs. So we see the creation of PFRED, which is the Pandemic Food Reserve Emergency Distribution Program. And the intent there was to provide direct food resources to pantries and community organizations across the city. And so it's important to note at this point, we're still basically relying on community organizations and pantries as our kind of main resource in trying to address food insecurity across the city. And they were authorized under an emergency rule. They were designed to be short-term relief, and we'll talk about why this is important later, but we need to really develop ways to address food insecurity that are not simply pandemic dependent. We need to kind of have a response that's much more coherent and much more integrated that goes beyond simply what we're seeing in moments of emergency. So there are a number of other things the city did in the ongoing pandemic response, all of which were outstanding in terms of their ability to reduce the potential reach of food insecurity. So they allocate an additional $27 million to PFRED. That's set to end at the end of this fiscal year. Increased funding for the Emergency Food Assistance Program, allocated an additional $900,000 for equipment grants that allowed food pantries to be able to store certain types of foods, allocated an additional $600,000 to fund technology upgrades for the city's emergency food network as well. So there was a fair amount of an investment. I want to just emphasize that so that we understand that the city certainly has made efforts to respond to food insecurity. It perceived this to be a very pressing problem, but we still have a long way to go, okay? So in the next few slides, we're gonna talk a little bit about what has happened since the start of the pandemic in terms of folks being able to access food that they need. So we can see here that when we start kind of measuring what people are doing in April of 2020, we find that there are kind of trends across all populations, those that are living in high poverty communities, those that are African American, those that are Latina, and Latino. There are trends that are consistent across those groups. What's most important to note is that while a number of New Yorkers have been able to return to kind of pre-pandemic levels of need for emergency food services, other groups, including African Americans and those living in very high poverty neighborhoods, continue to need emergency food services. Okay, so while there's a decrease in certain population, the need in other populations has continued to remain steady and increased after the pandemic. So this suggests that we haven't really been able to solve the problem. Richard, I see a hand, which is great.
Yeah, is it okay to ask now, or do you want to?
No, please feel free. Yes, hands throughout the presentation are great.
I'm good with reading charts, and I'm just so startled. This is saying that close to 40% of all African-American New Yorkers had food insecurity and needed emergency food services in March of 2021.
That's what that's saying.
That's
what that's saying.
And half of people in very high poverty areas. That's just startling.
So, and I'm not, I don't want to say that's a good thing. The number is not a good thing, but I think awareness of how high that number is really important. So I think that this data, which is coming from the most recent NYC Epi brief, and this is in November 2021 that they released this, it highlights an issue that I think we're just, not fully aware of because we don't really see the numbers presented in this way. So I do hope there's some kind of shock value, for better or worse, and kind of seeing some of these numbers. So this is really important. And then to kind of just reinforce that those numbers aren't necessarily declining in the way that we might expect to see as time has gone on. So the window of time here is from April to October 2020. So good. So moving on, so we can see, and again, maybe it's equally important to point out where we are in April of 2020, just how high some of those numbers are. But if we look at what's happening here, in essence, there is some improvement from April to October in terms of New Yorkers' report about the availability of food and the accessibility of food. But if we look at where we're starting, 82%, for example, 79%, 74%, the numbers are very high. And then we see a slight decline over time But it's worth noting that if we look at what has happened, the fact that prices have increased is still a significant factor for most folks, right? So that's something that has to be addressed, and certainly we have to be mindful of that going forward. We also want to look at the kind of combination or the kind of relationship between kind of health status, household composition, and how the pandemic has affected the ability to access food. So we see here the kind of the purple dots are those who have a chronic condition, the reddish or orange dots are those who have households with children. And we can see that, you know, the kind of purple and the red tend to run neck and neck in most of these categories. And so we know that households where someone has a chronic condition, heart disease or other non-communicable disease for the most part, or households where there are children tend to have very kind of distinct issues when it comes to being able to access food, whether it's the fact that prices have increased, they have less income, or they have just simply less money to buy groceries. Their ability to get food has been affected throughout the course of the pandemic. And certainly these numbers might remain surprisingly high, even in October of 2020. So kind of finally, in terms of figures and statistics, and I think we already kind of heard this a bit from Shelley, we can see that about 12% of those folks living in Manhattan would report being food insecure. Our most kind of recent data suggests that that number is higher than in Queens or Staten Island. Certainly it's lower than the Bronx or Brooklyn, but certainly still a significant issue in the borough of Manhattan. So in the kind of remaining, I guess, 10 minutes or so, and I'll talk a little bit faster, but still welcome questions. I want to run through some of the food policies that we're proposing to think about trying to make the pandemic response into a long-term response that can really address food security in a much more comprehensive way. So as Shelley pointed out, this work was done in collaboration with Hunter and CUNY. We're examining the effects of the pandemic on our food policies and programs and proposing specific measures that the mayor and the new administration, new members of the city council will hopefully take up in their kind of efforts in office as well. So the first thing we propose is strengthening and integrating separate and dispersed food assistance programs into one coordinated agency focused on food security promotion. As you all know, we have a mayor's office of food policy, and certainly they've done a phenomenal job with a very skeletal staff and bringing so many different folks together in an effort to address the food security issues. But we really need to kind of step that up, and we'll look at a slide in just a moment that demonstrates how that can be done. The benefits of having a single organization are numerous. They can't be overstated. We can maximize enrollment in the Supplemental Nutrition Assistance Program, ensure access to affordable housing and healthcare. This is important because housing and healthcare are the two factors that have the greatest impact on whether a family will ultimately end up experiencing food insecurity. So they go hand in hand with the conversation of how we address this issue. Significantly expand fruit and vegetable vouchers and incentive programs. This is important, and we've done things in this regard. We just need to step them up. And then improve the nutritional quality and reach of institutional food programs in schools, childcare programs, hospitals, and senior centers, all of which we've done before. So how we kind of think about integration, I think is demonstrated well by the Baltimore Food Policy Initiative. Here, they kind of try to do what every large city will have to do if they're going to try to create a kind of coordinated response, which is essentially to take every aspect of that city's government and put it into the kind of pie, if you will, that creates an interagency collaboration on food. So if you kind of go around the wheel, there's room for the Department of Housing, Department of Planning, you have community development, you have kind of everyone at the table, so to speak. And we're really kind of inspired in some ways by this vision, and it's certainly where we want to go. So funding for that to happen is necessary, and hopefully it's something that will happen in the short term, and it will also allow for further evaluation of the food security policies that were put in place during the pandemic. So this is what we're striving for in terms of collaboration. Now, a word about SNAP, the Supplemental Nutrition Assistance Program, often frequently kind of formally referred to as food stamps. It can't be overstated the extent to which SNAP participation can really help both in times of crisis and in times of non-crisis. So just to emphasize that, if we get folks who are eligible for SNAP in the program before a pandemic, when there's not an emergency situation, we can certainly, it can be a protective effect, even in the context of an emergency. So we want folks who are eligible to engage with the program, even when there's not an emergency situation. And how do we do that? How do we get folks to engage? There's a number of different strategies. Increasing the maximum SNAP benefit can increase program participation, so folks understand that it's essentially worth it to be part of SNAP. This also increases household resources for food purchases and decreases food insecurity among those who are very low income. So SNAP, in essence, becomes the poverty alleviation program for very low household incomes, because the benefit does help them to use household resources for food and for other goods. And making SNAP more readily available to eligible able-bodied adults is an effective mechanism for increasing program enrollment. So we tend to focus on households with children, but there are a number of households that would qualify for SNAP where there are no children that also need to be part of our comprehensive response. So what else do we need to do? Next on our list is to ensure that food options are culturally inclusive. This is an incredibly important issue, especially in New York City, where we have such a diverse population. Lack of cultural inclusivity can be a barrier to people accessing food security programs. So if folks feel that there's not something that they would be able to eat, whether that be based on cultural or religious beliefs, they're less likely to engage with programs. And kind of going back to our previous point, we want high levels of engagement. So we want people who are experiencing food insecurity to already be kind of dialed into the system before a pandemic, and making sure that they understand that there are options available for them as part of that conversation. Anecdotally, for anyone who was kind of involved in kind of their community when it came to providing food, they understand the kind of diversity that was present in many instances. And certainly the ability to be able to respond to that is something that has to be integrated into not only kind of local response, but state and even federal food programs. So that's a very important piece. And related to that, I can't say this enough in enough different ways, is we need to have a preparedness plan that allows us to be in a position to respond effectively to any future crisis. So now that we understand how big food insecurity is and kind of the populations that are dealing with it in the most significant way, we should think about providing additional funding to offices like the Mayor's Office of Food Policy to conduct a thorough kind of trans-agency assessment of programs deployed during the pandemic. So we've just started that process. It needs to continue, and there needs to be kind of funding for that to make sure we understand what was working and what was not working, what could have worked better. So the last two things are really kind of part and parcel of a conversation that we could kind of have about ongoing kind of food systems improvement. We need to be able to do better surveillance. So kind of to the conversation that I think Richard and I were having earlier, we see those numbers from a single point in time, but we really need to be able to look at them over time to understand what's going on in different communities. We need to get this data at the city level. We need to be able to look at neighborhoods. We need to be able to look at specific zip codes. We really need to get very organized in our approach to measuring this, just so that we can become more nuanced in our policy approach. We do this in other domains in the city when it comes to education and safety. For example, we have systems that are set up to monitor these things over time, and it would be ideal to have something similar to that in the food space. Improving conditions for food workers. We now know that they're a very vulnerable population. They were still required to work in conditions that many were concerned about. And so we need to be able to support them in efforts to develop kind of a comprehensive workforce development strategy, make sure that their working hours are enforced. And we look at improving enforcement on local laws on wages, benefits, and health and safety. And last, but certainly not least, we need to support community organizations to develop and implement community food plans. So this kind of dovetails with all the recommendations around trying to make sure that we have the most comprehensive information. We have culturally inclusive food options. We have an understanding of what's happening on the ground. And I had the pleasure of being on NPR earlier this week, or I guess that was last week. The weeks are all kind of running together, but we had a caller who really spoke to the importance of faith-based organizations, for example. In his particular experience, they had done a tremendous job in terms of filling the gap when it came to providing food. So we can kind of have policies that promote systems and that promote all kinds of different surveillance, but we still need to come back to the community organizations, the faith-based organizations, and the folks who are really on the ground making things happen, making sure they're part of the conversation is critical. Kind of preparing New York's young people and community leaders to be effective advocates is certainly part of that conversation as well. So with that, I hope I have left enough time for us to continue the conversation. I'm going to stop sharing. Oh no, if I can figure out how to stop sharing, I'm going to do that. I should be able to, and then
It doesn't want to go away.
it's just this last recommendation here is just super. There we go. I think I've stopped sharing. And if there are any questions, I'm happy to answer them now or at the end of the presentation.
Right. So, okay, so we're going. Any questions now? And then I'm going to just go quickly to the resolution, which includes many of the points in the presentation, because I had the privilege not only of the discussion we had, but also getting data and information. But then the main thing is getting to our recommendations so that we can promote them. But let's start with any questions. Madge? You have to unmute. There you are.
Okay, do we have a quorum? And if we don't have a quorum, can we still pass something?
Well, we have a quorum right now. That's why I want to move to.
Okay. Well,
So that was the question. Okay.
Yeah.
My question is, Mark, go ahead, please.
Thanks, Shelley. In our experience with the Get Food program, and lots of money that was spent on that, and thank God for it. And I share Rich's reaction to the numbers during COVID. I got to tell you that the baseline numbers were pretty scary pre-COVID. So your chart makes a couple of interesting points there all at once. But the thing that stood out to me, and I actually tried to experience this firsthand, was what's been referred to as the last 100 yards. That the city buys all this food, they arrange for it to be grab and go, or they arrange for it to be delivered to, in this case, it was a tenant center at the NYCHA complex at Douglas Houses. But then the way the food got to the most vulnerable folks was through volunteers. And I hope they'll forgive me for saying, not the youngest of our neighbors, not the most healthy of our neighbors, but they're the ones that were trusted. And so I wonder if in our work on this and in your research on this, there is a recommendation, because one worries about the sustainability of this, because volunteers have jobs and lives and sometimes get sick themselves and et cetera. So you can spend all this money to make food available and not achieve your purpose. So I'm wondering, is there research being done on that, and what's the right thing to advocate for? And I see Mr. Silverman's with us, so that may be one of the answers. But is there more to be learned about that, and is there more policy to be pursued on that?
Mike, that's a great question. If there are experts on this in the room, I would certainly defer to them, in the sense that was not our kind of specific focus in this conversation. But to your point, the one that I really want to amplify the most, we cannot have a system whereby we continue to rely on volunteers to get that particular work done. And so that's one of the things that I try to highlight in our kind of conversation around this. We really want to kind of embrace the idea that we need to create a workforce or some other, so this is kind of where I kind of move into that direction, but we want to create a mechanism that is certainly in existence prior to a pandemic and can withstand the kind of consequences of a pandemic, right? So that development needs to happen now, which is why even if we consider ourselves to be post-pandemic, the work must continue. So I think the conversation around how to develop that workforce is certainly incredibly important. At the same time, we walk a fine kind of line because I think community organizations don't want their contribution to be overlooked. So we have to kind of certainly make sure we navigate that space in a very, I think, sensitive way. But it looks like Greg has a hand, so I'd love to hear kind of additional thoughts on that.
Yeah, thanks. Sorry, family duty called. Yeah, I mean, the Get Food program did an amazing job of quickly scaling up and bringing food to people as opposed to people to food. But I don't want to call it the Get Food program. I want to call it the Get Calories program. And I just want to be clear, like, you know, getting healthy, culturally appropriate food to people is what can and should be happening. And I think that has to be like, there has to be a keen eye on that, whether it's using tools like the Good Food Purchasing Program, or even just how we're updating EFAP to make sure that we're giving people healthy options and getting it to people. It's not the last 100-yard delivery. It is definitely the last mile or two delivery. Delivery is key in this issue because we need to stop throwing food at organizations as opposed to bringing food to where people want it. What we found during the pandemic, our customers, you know, it's not about a choice of kale versus collards first. It was a choice of, I need food brought to me at my door because I'm sick, I'm elderly, I'm caring for other people, and that's really important. And so putting money into those kind of systems, right? Whether it's workforce, like how do we get more distribution channels? How do we utilize taxi limousine service? You know, food distribute, like DoorDash was big in this, but this is all private. Like we were yelling from the beginning of the pandemic with the city saying, make a deal with the taxi and limousine service there's no customers getting rides, like give them some amount of money and you will be able to get a low price per ride. But I think we have to find innovative ways to use the transportation that we have and scale up other businesses. But
Okay.
yeah.
Good. So we're going to get to you in a minute.
No worries.
I want to see if I can project. Maybe I can. Is that shared? Good. Okay, I'm not going to go through the whole beginning, the introduction. A lot of the facts that were mentioned in the presentation, but let's get down to recommendations so that the resolution will be that will end up, therefore be it resolved that Community Board 7 urges Mayor Eric Adams and the City Council to promote legislation with appropriate funding to implement the following policy recommendations by the end of 2022. Improve the nutritional quality of food assistance programs, reducing food insecurity by ensuring access to nutritionally adequate foods will not only help prevent diet-related chronic diseases, it can help protect people from facing serious complications from COVID-19 and other infectious diseases. Allocate additional funding for institutional kitchen infrastructure, upgrades, and professional development of kitchen staff. Having the skills and tool to prepare and safely store perishable foods is essential to increase freshly prepared and plant-based meals that are appealing in schools and other institutional settings. Okay, third, let me just move this down. Okay. Providing nutritious meals via ongoing food assistance programs, as well as during crisis-specific events, will improve the resiliency of New York City's food system and the overall health of its population. Okay, work with state and federal agencies to reduce complexities and streamline food assistance policies going forward. The waivers and flexibilities issued New York Food 2025, that's the document goal. I think it's 1.5 during 1 or 15 during the pandemic by the U.S. Department of Agriculture regarding the National School Lunch Program were critical to enabling schools to continue providing meals to students. Moving down, okay. New York City should work with state and federal agencies to expand SNAP benefits to enable more individuals to purchase nutritionally adequate food in times of need, with a focus on minimally processed fruits, vegetables, and whole grains. Furthermore, be it resolved that Community Board 7 requests that between 2022 and 2025, the mayor and the city council should also draft new preparedness plans for future large-scale states of emergency. COVID-19, which continues to be a novel threat to public health, leaving too many New York City residents food insecure and at risk of becoming food insecure. To achieve this, okay, let's go down further. Okay. We need funding should be allocated for the mayor's office of food policy to appoint a team to conduct a thorough trans-agency assessment of programs deployed during COVID-19. The mayor's office of food policy should consult with food pantries, the Office of Food and Nutrition Services at the NYC Department of Education, the mayor's office of Immigrant Affairs, other agencies and community-based organizations to gather community input on what is needed to ensure culturally inclusive food programs and policies in New York City. The mayor's office of food policy should draft updated preparedness plans and establish procedures for regularly scheduled review and updates to plans that address the nutritional quality of emergency foods so that New York City is ready to anticipate and effectively respond to future needs. So we're not just talking about now, we're talking about in case of. And lastly, furthermore, be it resolved that Community Board 7 requests that the city's food policies and programs should continue striving to embrace and respect the diversity of our population. Dietary restrictions related to cultural or religious beliefs may hinder people's ability to make use of food programs if inclusive options are not available, e.g. lack of halal or kosher options. And specifically, New York City should support efforts of the New York City Department of Education to continue to expand the diversity of food options available in schools to be more inclusive of the variety of cultures in New York City. Okay. So let's see if So that is going to be the resolve. I don't want to go through 2 pages of facts that you've learned already from the presentation. So I would entertain a motion to approve the resolution. Audrey, okay, second. Kristina, all in favor, committee members? Okay. Okay, raise your hand or electronic hand. So that's all 5 of present. That is a quorum, and it's a unanimous quorum. Mark, you're the non-committee board member. Are you in favor? You're in favor, so that's good. So we have that vote, we will record it, and we will next Tuesday bring it to our full board. I will send out the total text as early as tomorrow. If you have recommendations for edits, for additions, for any alterations, please have a couple of days to do it because we want to get it to the office by Thursday, midday or early afternoon, so that they can have it on the agenda and we don't delay their process. Thank
Charlie,
you.
if you would entertain a thought on the resolution wording right now, I am delighted to support it as written. When you're calling out agencies for better coordination, may I suggest that we call out the Task Force on Racial Inclusion and Equity and the New York City Civic Engagement Commission, both of whom have been sort of at the forefront of trying to meet people where they are on pandemic-related concerns. Some of those have been more medical in nature, but I think that this dovetails with their work, and I think it would be an effective way to direct the mayor on how to do what it is you're calling on him to do.
Super. If you could send me either a text or
Yep.
the few words, definitely should be included. Thank you. That's excellent. And I know you're on the Civic Engagement Commission or Committee, right, Commission?
Believe it or not, I am a commissioner of the Civic Engagement Commission, but the
Okay.
work is done by the staff, not by me.
I get it. I get it. But
Mark, what was the name of the other committee?
It's TFRIE, so Task Force on Racial Inclusion and Equity.
Thank you.
okay. So moving right along, first, Sarah, you're willing to, if you want to stay, we're welcome. If you need to go, we certainly appreciate it. But thank you so much for a wonderful presentation and
Thank you.
valuable one. Okay.
Awesome. I look forward to kind of seeing where this goes. Thank you so much for having
Okay,
me.
and we will be in touch. Okay.
Sounds good. Thank you. Have a good night. Thank you.
Good night. Okay, so next and significantly, we have Chef Greg Silverman, who's the CEO and Executive Director of the West Side Campaign Against Hunger. My relationship with West Side Campaign was when it first came into being. I was chair of the area policy board, and we gave the first funding, okay, through there. And then year after year after year, and things have always gotten more elaborate and more directing at what the needs were locally. And now everyone in the city knows the West Side Campaign Against Hunger, okay? And with good reason, with a wonderful reputation. So without further ado, we've already heard some ideas from Greg. Welcome, and please feel free to tell us all and everything you want us to know.
Yeah, well, thanks for having me here today. As a chef, former multiple restaurant owner, longstanding anti-hunger advocate, recently co-chair of the Mayor's Transition Committee on Food Policy, and most importantly, the CEO for the last 5 years of West Side Campaign Against Hunger. So thankful for being based here in CB7 and to be here tonight to talk to you all about the work of WSCA and sort of the work, what's happening on the front line and how it's changing. I'd say on the Upper West Side and across the city and across the globe. So I'll give a very brief, this is WSCA, just for anyone who doesn't know, and then I really want to dive into what we've been up to during the pandemic and what we hope to have happen post-pandemic, does that sound good?
Before you continue, Robert, I see Robert has joined us. We'll be sending you a copy of the resolution we just passed.
Okay, Chevy, thanks.
Okay, welcome.
Yeah.
Okay, sorry, Greg.
No worries. So as Shelley stated, much longer than I've been a part of WSCA, WSCA's been, you were funding it upwards of 43 years ago. And WSCA's been on the front line with many other organizations and religious and non-religious entities on the Upper West Side, fighting hunger for all those in need, based at 86th and West End in the basement of St. Paul's and St. Andrew's Church. We were known at WSCA, the acronym for West Side Campaign Against Hunger, as the group that invented the customer choice food pantry model almost 3 decades ago. And now it's really the best practice norm, not just across the city, but across the nation. Customers for decades have been coming to WSCA to shop for healthy food, to choose the foods they want to help nourish their families. And not just to get food, but also to be supported with benefits enrollment by our social service team, who signs people up for SNAP, food stamps, of course, health insurance, you name it. We can find a direct sign up or a referral for all of our customers. So we're not a place that allows customers just to show up and get food. We want to make sure we give the full wraparound services that we know customers really need, right? Like, it's one thing to give someone great food, and we give the best food in the city, if not the country. I can promise you that. but we make sure that everyone gets the wraparound services. And I don't take that term lightly, the best food in the city or country, because when I came to Wisca, we were known to have the best food. And we gave out about 20% of our food in fresh produce. But I came from working with a lady named Michelle Obama, who said half your plate should be fruits and vegetables. And so when I came from Washington to New York, like I knew we could do better. Now we give out 50% fresh produce in every bit of food that our customers get. So we used to give out 4 years ago, 2 million pounds of food. Now we'll give out over 2 million pounds of fresh produce alone as part of upwards of 5 million pounds of food in general. But you know, we're an organization that partners, right? It might seem like customers are always coming to us, but really we've been about partnerships. And I'll give one early example is how we've been able to grow some of this work, as Shelley said, across the city has been in partnership with, for example, for New York Presbyterian, which is really important because not just that it's a major entity, a huge nonprofit in the hospital, but that it's in the area of focus in social determinants of health. Like it's focused on prevention. And so we came together with New York Presbyterian before the pandemic and built a partnership to test out bringing food to families in need and evaluating through Columbia University's, and New York Presbyterian, the impact on people's lives and how it's actually by distributing food to families in need, moms with young kids, that we could actually decrease BMI within 6 months. And these are all things that are being shown and evidenced and being put into papers that they're actually putting forward right now. So Wisca, what we did is we're good at food distribution, we're good at sourcing, we're good at benefits enrollment, but we're not trying to take over anyone's business, right? Like what we like to do is partner. So we piloted with the New York Presbyterian and their community partners outside of our core area based in the Upper West Side. So whether it's going up to Washington Heights, working with Nido de Esperanza or Northern Manhattan Improvement Corporation, going down to Brooklyn with Campbell or down Lower East Side with Henry Street Settlement, we found partners that we could work with through New York Presbyterian to distribute food to customers in need. And so this is us adapting at Wisca. Like we're known to be a place that, thousands of customers come to on the Upper West Side. But really what we realized, like most things these days, is it's not about bringing people to food. Dignity and respect is about bringing food to people. And so we've had to adapt. And we adapted during the pandemic, especially, when the pandemic first hit and we realized over 700 seniors stopped showing up to pick up food. So to that point of delivery, we partnered through United Way with DoorDash. We tried all different models and we delivered directly to people's door. We started calling people directly. Instead of waiting for people to show up, we called them and we asked, what do they need? We started signing people up for benefits, right? Virtually. We didn't make people show up at 86th Street. We reached out to them. And because we're actually a safe place that people feel that they want to go to, and our staff are safe to them. So we really built those relationships. And we found, hundreds and hundreds of new volunteers and partnerships through New York Cares. And we created, upwards of, I think, over 65 community partners that we distributed with across all 5 boroughs. So, as I said, in the last year, 50% of our food is fresh produce, where many pantries were closing during the pandemic because they just didn't have the wherewithal to be able to serve, and partly due to the volunteer base. Wisca's was able to dive deep, right? We have a strong volunteer base, especially on the Upper West Side, who was able to continue packing food for people, making sure that we could distribute. We never missed a day of work, right? And I think that's a testament to what has been built by the Upper West Side community with the West Side Campaign Against Hunger. I'm happy to be the head of it, but like this organization's, been around 3 decades more than I've been here, and that's the power of the base here. And I think, if you start thinking about it, and I look at this district and say we can isolate out, right? Before the pandemic, we had about 4,200 households representing about 10,000 customers. That was at the peak. About 10,000 customers were coming to 86th Street. And before the pandemic, we were at about 8,000. So we've gone up some from our peak, but mobile outside of 86th Street, pre-pandemic, like just before we had started, thanks to participatory budgeting, we had got a mobile truck, right? We started distributing at 14 locations, and we were sort of pre-pandemic. We had about 2,200 households, and during the pandemic, we're upwards at around 8,000 households. So before the pandemic, about half of our customers were being served away from 86th Street, outside of the Upper West Side, outside of CB7. Now, twice as many customers are served outside of the district. But at the same time, our numbers at 86th Street hold strong. And I think that the key for that is, what we like is we're going to bring more sites on across the city, which in some ways cuts the numbers that come to 86th Street who are coming from far away, so that who we actually serve at 86th Street is CB7. Right, that's our goal. We want people to not travel far. We want to give them the best services possible. We want them to come to 86th Street and have a great experience. But we don't want them coming from Soundview. We don't want them coming from Staten Island. We don't want them coming from, Canarsie. Like, we want people, staying home with their families, being able to doing their jobs, whatever they want to do with their time. And we can then distribute where people live, where they learn, where they play. And that includes, in CB7. So, I think for us, it's about that food and getting people the food where they live. It's also giving people the benefits access, like I said. And so we've connected over 10,000 people in the last year to benefits. And that's a huge achievement for us. That's making sure that customers don't just get the food in the short term, but in the long run, they're getting the benefits that stay with them. This is real cash. And for people, and whether it's your housing vouchers, whether it's health insurance, whether it's SNAP, these are the things that really lift people up out of food insecurity. And we continue to advocate. I'm sure most people on the call know about EFAP, the Emergency Feeding Assistance Program, $22 million for emergency feeding for emergency food providers across the city. WISCA, I know that we led it because I helped write some of the sentences in the new RFP on including fresh produce, because $22 million of food that the city has been giving out to the Emergency Feeding Assistance Program had to be given in the form of shelf-stable food. So not one pantry was able to get 1 pound of fresh produce for years through EFAP. And that RFP just came out and it just changed. So we just got it changed. And that was a huge achievement. The next step is to increase how much money is in EFAP, but allowing organizations to have access to fresh produce is important. I'm not saying they have to give 50% produce out like the West Side Campaign Against Hunger does. I want every pantry, big or small, to have the choice of getting the products they want for their community, period. It's not me to say what they're going to buy, but it's for me to say everyone should have the choice. And I think that's been pretty important. I think that's how we've been advocating. We also became part of, we advocated for a bigger seat at the table in the anti-hunger community in New York City. And so the Mayor's Office of Food Policy created a innovative capacity working group out of the pandemic to sort of test out new ideas. And it had the usual suspects: Food Bank, City Harvest, United Way, and HRA, and the Mayor's Office of Food Policy. But for the first time, they had frontline providers in it. West Side Campaign Against Hunger, the Campaign Against Hunger, Met Council, and New York Common Pantry are all part of this innovative capacity working group. And I think it's important that those four are on it, because quite interestingly, at the same time, in the last 4 years, the West Side Campaign Against Hunger, we created what's called the Roundtable, what we call Allies for Food Access, which is a collective purchase group of 8 of the largest emergency food providers across the city, 4 of whom are the ones I just mentioned, who are part of the Innovative Capacity Working Group. So the groups we're all working together on a regular basis to decrease cost for our organizations in food and increase the quality of food for ourselves and for other groups. And we were able to advocate related to EFAP. We also led the advocacy statewide and met with the governor's office on a Sunday morning to push and gain vaccines for frontline workers, not just for WISCA, I care about WISCA, but I care about the entire sector. So, making sure 10,000 workers across the state had access to vaccines when we weren't on any list to get the vaccines. So we've been trying to do more advocacy, not just ourselves, but as part of the network of providers across the city, because we all have the same issues, right? The roundtable, the 8 members, distributed over 29 million meals during the pandemic. Like, we're a sizable force. And we say that because we see ourselves as partners to the food bank in City Harvest and United Way, but we also want to be the advocates for the frontline workers and the frontline organizations who are really on the ground day in and day out to make sure that the right food is getting to all the organizations. So that's what, in general, we've been working to get, whether it's New York Presbyterian, whether it's 64 community organizations across the city, whether it's our core group of customers and volunteers who keep everything going each and every day. It's all in partnership. Like, that's what we've been doing for decades. And we just continue to be able to use our platform to do more of that. In the future, I'd say, the truth is that the methods and models, I'd say, of fighting hunger, and I think the folks from, I think it was from Teachers College who spoke before, like, we're hitting on this, right? The methods and models of fighting hunger in New York City, they're outdated and they're certainly undignified. Like, Get Food was not a dignified model to feed people in a pandemic. It was a great way to get food or get product to people in a very almost like refugee sort of situation, but we can see that we can even do better in Ukraine right now than some of the food that was being distributed through Get Food. But best practice in fighting hunger is to give people a choice. And it's not just kale versus collards or carrots versus bananas, but how do you want your food? Do you want to pick it up yourselves? Do you want it delivered? When do you want it? Do you want nighttime hours? Do you want different locations? Or do you simply want people to be given back your time and convenience? We have to give people the choices they want. Not necessarily, like, many WISCA supporters, have battled on this topic with me. And I think the proof has been tested out, and CUNY Urban Food Policy Institute is doing research with us. The choice, many customers want a choice, like I just described. Many supporters of WISCA, many folks who donate and want to be behind the scenes of the West Side Campaign Against Hunger and volunteer want to see, like, the choice model pantry in the basement. That's their gold standard. It's like, but that's not the customer's gold standard. The customer's gold standard is convenience. And we can have all of these things. Right? Like, our goal is to give people the options. Bring back in-person shopping, great. Have people pick it up, a box of food up on the street, great. You're infirmed and can't leave your house, get it delivered to your door, great. Like, that's all we're saying is, like, give people choice. And it's not out of the realm of possibility. People with means can get groceries delivered in 15 minutes on the Upper West Side, right? Like, this is the new odd world we've had. So we're going to keep pushing very hard. We've invested in technology to build out tools for our customers to be able to choose which foods they want via text messaging. And this is where CUNY Urban Food Policy Institute is evaluating this to make sure it's the most customer-centric thing we can build. And it will be fully open source so that any other organization across the city and beyond who wants to take it can have it. I'm not trying to own any tool. We're investing in more partnerships to deliver food into people's neighborhoods and investing in the community partners. We're investing in our infrastructure to meet the needs. That's, new finance different pieces of software. But the biggest investment, to be honest, and this to some people it's a shock, but we just signed a 20-year lease on a 15,000 square foot warehouse in Washington Heights. We're not leaving the 86th Street by any means, but we want to decrease the burden, right? The St. Paul St. Andrew's Church building is a wonderful community space. It is not a warehouse. It was not meant to bring 100,000 pounds of food into a basement every day, every week. That's just not what it was built for. And it's not an efficient space for doing that. It's a great space for distributing food and having community engagement. And that's what we're going to zero in on 86th Street. But, the core, the lion's share of where the food gets dropped and moved will be a real warehouse, a former U.S. Postal Service distribution facility in Washington Heights. And so, obviously 86th Street is part of this post-pandemic. We want to revamp and rebuild some of the spaces and make it, the best practice space that it continues to be. So, we're in the beginning phases of a capital campaign for both the new warehouse and 86th Street renovation. The roundtable is an interesting idea that I think we're just starting to talk to city folks, like city council members, about, to say we think this should be funded by the city. We have private funders, UJA, Robinhood, New York Community Trust, who have all invested in this collective model, but we think it should be embedded in the city so it can scale more rapidly, and that more organizations can join it to be a real collective frontline mechanism to hear, so everyone's voices are heard across the system. We also think, and this is to Teachers College and CUNY Urban Food Policy Institute, like, more money has to be earmarked for evaluation. We're seeing like real results. I'll give the best example. We're seeing results, like I said, on decreased BMI due to food distribution as a preventative measure through a hospital. And right now we're starting to advocate on Medicaid waivers, right? Like this is what we want, right? We want Medicaid to pay for food as medicine. Like, this is happening. North Carolina's done it. California is about to do it. New York can do it. But what we need to sort of fund these kind of big advocacy pushes is strong evaluation. And the emergency feeding sector is super weak on evaluation, not just in the city, but across the country. And so if the city started thinking more diligently, and I don't mean evaluation by like the Department of Health or, internal agencies, I mean external at rigorous academic evaluation. And we're starting to see that through the Mailman School and CUNY Urban Food Policy Institute, and certainly Teachers College, in the same way that school food has been evaluated and school feeding across the country. And that's the world I used to work in. Like, that should be the way emergency feeding is looked at. And then we will have best practice examples that will rule the day. So we need to fund that kind of evaluation. And as I said earlier, I think pushing on EFAP, the Emergency Feeding Assistance Program, to increase the funding pool, because as more groups are advocating for good food purchasing and other models of making sure that we're paying workers the right wages and we're getting the right food and it's environmentally friendly, and all those are all really important, but it's going to cost more. And so the Emergency Feeding Assistance Program at $22 million, there's going to be some recommendations that are probably going to look to be saying, like, I know some groups looking to say it needs to be doubled, right? Like, these are sort of these, in the big picture, it's not actually a huge number, but we need to like step it up if we want to make sure we're giving our customers across the city, those in need, the best food possible. Because the truth of the matter is, our hunger numbers are not going down. They were high before the pandemic. They've gone up, and as we keep seeing things related to eviction moratoriums and all the different issues, all the different helps that were during the pandemic, they're all going away. So the numbers are going to go up. They're not going to go down. So we need to be ready to continue to sort of double down on how we're helping people in need. So I'll pause there. I will. The only other thing I'll say is thank you to folks on the community board for as we're looking in June to bring a lot of our community back together for like a volunteer block party. Folks on the community board, Seven, have been really helpful in helping us secure the permits we need to do that on the Upper West Side on June 5th. So just thank you for helping us move this forward and to be able to bring more volunteers and customers together and the community together in a way we haven't since the pandemic started.
Great, thank you, Greg. One thing I'd like to ask, if it's not too much of a burden, if you could send us policy and or funding requests, because we have a district budget priorities that go together with our district needs. So certainly food insecurity and access is one of our three consistent, most important things. But we want to get down to some nitty gritty, what is needed now, particularly by WSCA, because WSCA and is serving our community. But it's as specific as you can get. Some things may not be, what's needed. And if it's double, what's now double. You know, if you want to overestimate, that would be good. If you can't get down to actual numbers, we understand that. We don't want to be overburdening.
Can I just ask,
Sure.
when you like, right, I mean, I know sort of what different groups are advocating for example, EFAP. That's a big number for, it's not just for WISCA, but for like WISCA.
Right, sure.
When you say you have budget for organizations, is this in the same, like, what bucket are we talking about? 'Cause
Okay.
This is one that I haven't, is
So-
this DYCD money or?
No, it's all city agency money, okay? Well, what we do is we do our district needs and priorities, and then we do our budget priorities, capital and expense, okay, budgets. And our top requests, all of them go to our elected officials, and we advocate for them during the year, especially at budget time. But if we have specifics, the more specific we can get, the more effective our advocacy is, because they say, sure, we should have better food, you know, but what's going to make that happen? So the program or the practice or the funds for, those are the things that make a difference in our advocacy. And it's not only advocacy at budget time now, but ongoing budget time, even leading into the next year. Certain things may be more appropriate for the state or federal government. Well, we're going to hit our electeds in those areas and push. But we want to hear from who's doing it, okay, on the ground. And if not WISCA, who else? Does that make enough sense?
Yeah, yeah. No, not a problem at all.
Okay.
I can send it over to you by the end of the week.
Amazing. Others, any specific questions? Rich, go ahead.
Yeah, and just to clarify, if it wasn't clear, the district need statement is a recommendation. We don't have our own budget.
Yeah, I got it.
Yeah, we don't have.
Two questions. One, tactical. At least for the past 2 years, I don't know if it's continuing, all public school parents, regardless of means, got food stamps, got EBT cards. And I think a really strong message could be put out to those public school parents that if you're fortunate enough that you don't need that funding, you might consider contributing it to organizations such as WISCA. Is there a way that either the community board or WISCA might be able to promote that message?
So, there's been a few people who have brought this up early on in the pandemic. And, part of the problem is some people are like, oh, can we just like sign over our checks or whatever? And there's like the whole, no one wants to play to the very extreme right ideas of fraud in the SNAP program that doesn't exist. Like there is no fraud. Like we don't want to be a part of some idea that doesn't exist. And we couldn't find the different groups we talked to. Different people were, sending out to their Facebook groups and things like, oh, do this with the money. I mean, it was really tricky to find a clean mechanism. I mean, what we told people to do was, use the money yourself and then make a donation, right? Don't like the idea of someone saying like, oh, I'm going to use the money. I'm going to buy a bunch of canned goods and I'm going to bring it to WISC. It's like, that's super inefficient. Like we can buy a lot more goods wholesale. So like use the money. I mean, it was like a great idea to simplify bureaucracy. It's the same of like how many cities, everyone has access to, school breakfast and school meals because it's just decreased the burden of bureaucracy to track these things. But yeah, no one that I've seen yet, and I'd love if someone has a model that made it an easy way to do that.
Yeah, but at least putting out that message of, if you got this money and are fortunate enough that you're able to afford groceries, otherwise spend it, but, consider making donations.
Yeah,
I think is a powerful message. My other question, and your answer kind of gets to this, is I'm curious about the relative cost of food, because ultimately what you're doing is very similar to what grocery stores are doing of buying food and making it available to New Yorkers. I'm curious how your cost structure compares with either grocery stores or in cities like Fresh Direct in terms of being able to access the food and your cost of distribution of the food?
Well, obviously, right? Like we give out food for free, right? Right. Clear, but we use a few sources to get our food, right? We have amazing partners in City Harvest, where we get a lot of fresh produce from, right? So we'll get 1 million pounds almost of product from City Harvest per year. Food Bank, we work with, who actually deals a lot of the, city and state contracts we get food through, and federal TFAP, EFAP, things like that. So we're getting a lot of dry goods through the Food Bank that in a sense is government contracts, so government funding. During the pandemic, obviously there was some PFRED and other programs got propped up, so we were able to get even more product through that. And then we buy product, right? During the pandemic, pre-pandemic, we bought about 35% of our food. And that's where we do a lot of fundraising for, right? To buy food. We also have a state contract with HIPNAP, which gives us money that we can use to buy food. During the pandemic, we're probably upwards of 50% of the food we buy, because we've raised more money and to be able to give out better food. And also because we outsource some of our distribution to be able to reach more customers. And we didn't want to just bloat our staff and buy more trucks and just build gigantic infrastructure that we hope will go back down in the next couple of years. So we're paying more for food, but that's where the collective purchasing comes in. Just like, I'm a former restaurant owner, so I'm used to this. And same in the grocery business, like we're buying from wholesalers, right? We're going to Hunts Point. We're making relationships there. We get free food from some of the big distributors at Hunts Point who, if they got a pallet of strawberries, that it's very odd, right? If strawberries only have 7 days of shelf life, the wholesaler cannot sell it to the grocery store because they're afraid that the customer is going to have strawberries that go bad 2 days after they get home. But for us, if we can give strawberries to a customer and they have 4 days of shelf life, they're fine with that. And so for the distributor, shockingly, we are cheaper than trash removal. So in the food waste argument, like the distributor's like, if I can give you these mushrooms or these strawberries or these products that are going to go bad, but actually bad is really means we got a week of shelf life and we're going to get rid of the food in a day and a half. So we use all these different mechanisms to distribute food. I think you're also seeing right now just, and I think Riverside Church is working on this model. You have, I grew up in Utica, so that's where Bargain Grocery comes from, but there's models of grocery stores that are doing super reduced pricing as a model, sort of like a hybrid for-profit, nonprofit model where you can distribute free food to people and then also charge at a very low rate for groceries. So there's a lot of different models. I mean, I think we need all these models to figure it out. But like, yeah, we're spending a lot of money on food, and it's thanks to the zip codes that 10023 and 10024. We have thousands of donors in those zip codes, and those people have supported our ability to distribute, exponentially more food to more people, and it's still being healthy food.
Well, okay, Mark.
Thanks. Your last answer prompted a question. A friend of mine was involved in the USAID Food for Peace program, which is a federal program and an international program. And one of her problems is that a string attached to the funding is that she has to source her food from particular locations, mostly domestic US, where they could do more good by sourcing it directly in the Sudan. Are you subject to any of those kinds of restrictions or requirements with any of the funding you get? And does that significantly alter your model or your ability to reach the folks you need to reach?
Well, funny, I mean, I'll answer that. And a quick aside is I sit on the board of Farm Africa. We do a lot of work in East Africa. So we actually have been involved in some of that stuff through Ethiopia and chickpeas and sesame seeds. And so I sort of understand how that all works. Our state grants have had restrictions from HIPNAP and Nourish on the food. And really the restrictions have been to buy New York State product. And what that has forced us to do is to buy amazing produce from New York State farms. And so when we think about the big picture of like helping the regional food system and like keeping people in business, like that has been amazing. And our customers have loved the product we've got. So have we paid more for kale and for lettuce and for onions than if we were getting it from wherever, or garlic? Like, yeah, but we're like, we have this money, we can spend it and we can buy it locally. So, you know, the same products you're getting at the farmers markets, we were distributing out across the city. So it's cost us more, but we've had the funding to use. And so it's actually been, it hasn't been a problem. There hasn't been the city funding hasn't had any restrictions. I mean, I think at a certain point, it would be amazing if there was some, this is more related to a good food purchasing program. Like, do you put a, you know, even 300-mile radius on produce? Like, it's possible for a majority, if you say like 75% of your, I think it was 75% of our produce had to be within New York State that we purchased. It was like, maybe it was 75% of our money from our state food product had to go for, say, fresh produce, and 75% of that had to come from New York State. It's like, okay, great. Our biggest issue is we wanted to get fresh milk. We wanted to get shelf stable milk on top, besides just fresh milk. And there was very little, like 2% shelf stable milk available in New York State. Like, just the factories don't exist really for it. There was at the time in the pandemic. So I think they're scaling up, but yeah, I mean, I'd love to see more restrictions personally, because it just means we're going to be forced to give great product to our customers.
Okay. Greg, want to thank you so much. Okay.
My pleasure.
Not only for the presentation tonight, but for all the great stuff you do and lead all year round and year after year. And we appreciate it tremendously. Okay. And how creative and how things are developing. It's just wonderful, really. Very special. And more people should know about it. We're going to spread the good words. Okay. So we thank you. And the
Thank
only
you all
thing,
so much.
okay. And the only thing we have left to do is just discuss next month for a few minutes. Greg, you're welcome to leave. You're welcome to stay.
I'm gonna put my kids to bed. Go put my kids to bed,
Please.
and then we'll get you
Please.
this week some budget request dollar amounts.
Super. Thank you so
All right.
much. Okay.
Thank you.
So we have May is right around the corner, and we don't have a pre-planned agenda. Okay, so if anyone has right now or wants to contribute in the next couple of days ideas for a topic that may be of interest and may be worthwhile, particularly with our district needs and our need to do our district needs and to get a closer picture. One thing I thought of, but I'm not going to promote it right now, is we advocated with a lot of resistance to safe havens. And now in the proposed budget, there is $178 million for new safe havens. So that's just something to think about, okay? But that's my bias. But if there's something that particularly interests you or you want us to explore, take a look at the district needs statement from 2023. It's online, easy to find. That may give you some ideas. And I think we should focus on things that may be good for the budget before it gets too close to June budget decisions. Okay. Meantime, everybody have a good rest of April. Okay. Remember that April showers, which we're going to get tonight, bring May flowers. But the question is, what do May flowers bring? The answer? The pilgrims. Okay. Any last thoughts? Okay. Motion to adjourn?
Yes.
Okay. Unanimous. I see it's unanimous. Okay.
Great meeting, guys. Thank you so much.
All right, thank